This conference will now be recorded.
Hello, everyone. So, yeah, I think enough people have joined. We can start off with the orientation session for today. So, I am Dr. Rashmi Patil, Director and Chief Mentor of Rayz Academy. Welcome all of you for the introductory session on MRCOG Part 3. So, no way looking back from here, and it is just like we have to fill our eligibility form and then we can book for the exams and go ahead with the same. So, let us discuss briefly what exactly Part 3 about. Some of you may be aware about all these things, but for the new candidates who have joined, I just want to brief like what exactly we need to do before sitting for the Part 3 exam. Now, the first thing is the eligibility assessment of training, everything. So make sure that you have filled all these forms and all. It's very important. The assessment has changed recently. Initially, it was for the Part 2 exam. Now they are asking for the Part 3 exam. So 4 years of working experience in the Department of Obstetrics and Gynecology is what they expect. Once the assessment of training has been approved, we can look into more of the RCOG website details as such. This is the new RCOG website which they have developed. So this will be for the public where you'll be getting all the patient information, leaflets and all. You need to sign in using your account and you'll be getting here the college number. That college number is specific. So we have done through the Part 1 and 2 exam, and all of us know that how to go ahead with the college number, the registration, everything. Now, regarding the courses and training in that, you'll be getting the information about the current exams that are going on. What is the MRCOG Part 3 May exam is waiting for us. The deadline for all the candidates to ensure the home address and the email address they are up to date is today. So 6th February 2023, please, if there is any change of address or email ID, please make sure you do it now itself. After that, you're not allowed to do this. There will be some discrepancies and all in terms of the while you're booking your exam. So it is advisable today you need to confirm the home address and your email ID. Why this is necessary? Because there are centers where remote online is going to be conducted. Chennai and Malaysia face-to-face is there. UK, Delhi, Singapore face-to-face exam is there. So other overseas exams is yet to be confirmed. As of now, if you look into the details, 10th and 11th of May is an online and face-to-face in Chennai and Malaysia. 15th and 16th is UK, Delhi and Singapore face-to-face. What I am expecting is another 2 days. They may keep in between also. That could be for the overseas also. It is not yet confirmed. Once the deadline for all the changing home address is done, everything, the change assessment of training, everything, the deadline was already for the January 2023. So all of you have already got it done. The priority booking, for example, they would send a mail for candidates who have not sat exam for a long time, or they are like waiting a list for a long time, they are not able to book, and some priority basis, for example, UK people. Then there are Chennai, Malaysia centers like face-to-face, other thing and all. Here, the booking window opens on Thursday, 2nd March 2023. I want all of you to note down this date in calendar. Why this is important? Because within a fraction of like 2-3 seconds during the recent May exams and all, within a fraction of seconds, the seats were getting fully booked, I mean. So it was like completely full, and candidates kept on waiting for more than half an hour, 1 hour. Then some payment, if they had failed, again the booking token would open up. Then again you are able to book the seat. I will guide you through all these things like how to book and all. So I'll be there available for you on the Thursday, 2nd of March during your time of booking also. What we need to concentrate now is make sure that everything is in place and your email ID, address, everything is done, because according to that email ID and address that you've quoted, you will be getting your priorities here. If you are a resident of India, then you're giving your address as India only, you will be able to book the face-to-face exams. There will be global exams also, like remote online, what they have quoted, where it comes for second booking window. Now they have mentioned this booking window closes, but trust me, all the seats get booked within like couple of minutes. Nobody is going to wait till 6th of March. All the seats are booked on 2nd of March, the moment the site opens up, and within maximum like couple of minutes, everything gets booked. Second window opens for the candidates who have got the global online exam. And booking window, they say it closes here, but again, all the seats are going to get booked on 9th of March. So please mark your calendar regarding your priority booking, which opens on Thursday, and second booking window, which opens on 9th of March, again Thursday. So these 2 Thursdays, if you're having some work commitments, travel plans, anything, keep yourself free and have a person like tech-friendly person stand by with you. Okay, I'll guide you again how to go ahead with that. Now, part 3 exam is going to be a clinical assessment of your knowledge, what you have studied from your part 1 and 2, your skills, application, how is your attitude, and what are your competencies. Passing part 3 will get you the degree of Mrcog that you all have been waiting for. And this could be the waypoint to enter for the UK as well and go for the higher studies like ST6 and 7 level. So most of us are aware that it consists of 14 tasks in a circuit manner, and each task is taken from one of the 14 modules. These are the modules which they concentrate upon: teaching clinical governance, core surgical skills, post-op care, antenatal maternal medicine, management of labor, delivery, postpartum problems, gynecological problems, subfertility, SRH, early pregnancy, gynecological oncology, urogyne and pelvic floor problems. One station will be picked from each of the module. Sometimes there could be an overlap. For example, you got a teaching and a clinical governance and you didn't get any other module also. That can happen. It is not strictly that exactly it happens, but one station definitely comes from each of the module. The task goes like ABC. There are 14 stations allocated. In face to face, there are small cubicles which are created. You need to sit in front of your role player or your examiner and then have a discussion. Outside the cubicle, you will be getting 2 minutes to read your instruction. In those 2 minutes, you need to write down there. A pencil and a notepad will be given to you. You need to write down the key points. If it is online exam, there is a small column where you need to type the key information that is required for you. Okay, so once the station starts, you need to do these things. Now you have 10 minutes to perform. If it is face to face, after 2 minutes, excuse me, a bell will ring, and then you need to go inside the cubicle and start with your station. Once the 10 minutes are over, you come outside, move to the next cubicle in order. For example, I started with cubicle number 3. I went in the order of 3. After 3 was 4, then 5, then 6. I ended my circuit with station number 2. Similarly, the one who started on station number 10 went to 11, 12, 13, 14, then again 1, 2, 3, 4, 5, 6, 7, 8, 9. So in this circular manner, everyone performs their task for 10 minutes. This is the face-to-face. When it comes for the online exam, the laptop screen which is there, it will be showing certain boxes where you'll be seeing your role player, examiner's face, then a lay examiner if they are there, and there will be a column where the PDFs are seen. There is a small column where you're going to type your details. That keeps changing with the very next station. It becomes blank. And once the 2 minutes are over, suddenly the screen, it pops off and your role player pops in. And you need to start your task. So I will guide through the Osler also, the one who are booking for the Osler exam, online exam. I'll get in touch with them and prepare them regarding the same. The one who are going to give face-to-face exam, there are small changes which are necessary. So I will guide through them separately. Now, once this 10 minutes is over, go back again to the next cubicle, start reading your 2 minutes instructions. Then again, go inside once 10 minutes is there. So the bell rings. 2 minutes, 10 minutes, 2 minutes, 10 minutes. It goes that way. And in the online exam, you get a timer, like 30 seconds remaining. And there is a break for online exam. at 7 stations. So usually get like almost 10-12 minutes break where you're not supposed to go because you'll be observed by the chaperone. If you want to leave your seat also, you have to take a permission. What kind of task will be there in the exam? It is a simulated patient task. Simulated patient task with the lay examiner, which is a maximum scoring station because you'll be judged by all these people. Structured discussion where directly you're sitting in front of clinical examiner and you're having a discussion, and then you move from one cubicle to the other. And all these tasks, they are judged either on 3 or 4 domains. Sometimes 5 could be there, but usually 3 or 4 are there. The safety points: communication with your patient and relatives, communication with colleagues, information gathering, and applied clinical knowledge. Very important one are the patient safety and how you communicate with your patient and the relatives. This is very important. You need to concentrate on what task could be judged by which of the domains. In SPT, with or without lay examiner, all 5 domains can come, 4 can be there, or even 3 could be there. Structured discussion, there is no communication with your patient. The remaining 4, it can come. The scoring will be 210 as pass, borderline of fail. This scoring goes for each domain in every task. Okay, so if task number 1 is there, it has 4 domains. Each of the domains are going to be judged by 0, 1, and 2. There are certain key points which are must. There are certain sentences which you should avoid. And there are few important star points or asterisk points which you require to tell in order to get a pass marks in this. So I'll be guiding you through all these important things, how to go ahead. Now, speaking about the general template where most of the students, they spend time. I have seen candidates even like a month before exam taking 8 minutes of information gathering. That shouldn't happen. Information gathering is very crisp, targeted, and it should get over within 2 to 3 minutes maximum, because the rest of the station, it concentrate on the other domains as well. You are not supposed to spend your 8 minutes on one domain. So I give these template in the like the Telegram groups also, where I ask them to practice it at least 5 times a day, every day. You are just fluent with that, and at your spinal level, you're done with your information gathering within 2 minutes. And nowadays, it's very important that you take a targeted history. For example, in accident and emergency, the patient is in pain or she's breathless, she's vomiting, and you're asking regarding mental history, that how you have been past 4 weeks or past few weeks. It is totally unacceptable, and it is totally like an invalid question for an accident emergency patient. But instead of that, you ask allergies. That is valid. You stabilize your patient. That is important. You tell her what is to be done next. That is important. Don't ask cervical smear, have you been regular? It is not important for a person who is having, like, for example, early pregnancy and she's vomiting and she's come to accident emergency. What will you do with her cervical smear? What will you, like, you, excuse me, for her, support is important. So such questions are there, and I'll be guiding through each task when we are giving feedbacks, like, okay, what is important, and other things like what is not necessary that can also be skipped. These information gathering points I have written in detail because at least you should know what you're asking. As and when the tasks are being submitted in the Telegram course group, you will learn to cut short the sentences. Okay. Now, introduction about yourself, who you are, where you are. This is very important because the role play doesn't know whether you're a consultant or a doctor or registrar, who you are. And she must have come to meet Mr. Smith, and you're seeing Dr. Patel sitting here. So you should see, like, introduce and be very quick and fluent. So I'll just go through what key points have to be covered. This is a general information gathering template that I have formed. Not necessarily every point needs to be asked in every station. Please highlight this. But why I'm discussing in detail is you should know what you're supposed to ask in a crisp way. So, introduction, Hello, I'm Dr. Patil, one of the doctors in antenatal clinic today. And can I confirm your name, age, and date of birth? How would you like me to call you? So do not say like, can I call you Kelly? Why like you want to take the authority to calling her anything that you want? You allow her to decide. Or she would say, call me Mrs. Smith. Don't call me Kelly. Suddenly you don't know. So just ask her, like, how can I call you? Or how can I address you? She will tell something. Then you say you need to know why she has come here. Perfectly, I understand that you're here today because you want to discuss about your pregnancy. Is that correct? And thank you for confirming. So, Kelly, since we're meeting for the first time, is it okay if I ask you a few questions to know more about you, and then I may need to examine you if required in presence of chaperone with consent and run some tests if needed. Then I'll discuss the evidence-based management options that are available for you, and together we can arrive at a mutually agreed safe management plan which is acceptable to you. How does this sound to you? It hardly takes like 6-7 seconds to finish this entire thing if you're fluent. That's why practicing is very necessary. You can cut short these points also. Like, for example, if you want to keep your agenda small, say that's it. Is it okay if I ask you a few questions and then we form a management plan? So if you say this also is okay, how does this sound? She would say okay. Now this point that in the end what you want to do, it is left to you. If you're able to finish your task in time, you can tell these points before, like later on. If you're not, then you can tell these points before. At the end of consultation, I'll provide you certain leaflets and emergency numbers if required and put you in touch with support groups. Is that okay? So these kind of questions or introduction, I am telling this in the scenarios where you're sitting in the OPD clinic. Every module has a different approach. Every station has a different approach. If it is accident emergency, I'm teaching completely different introduction. If it is structured discussion, it's a different introduction in the SPAR format. This suits where you're sitting in an OPD, and most of the time it is going to be antenatal maternal medicine or urogyne or general gynae OPDs and all, or pre-op consents. So this suits the modules. Then put up an open-ended question. That is important. So can you tell me more about your concern? She would open up. And if you have time, you can say, I'll address them to best of my capabilities. If consultant is not there and you are replacing, you can say this sentence. Now take a detailed history about complaints. HOPI should be targeted to the system or pregnancy or whatever her concerns are. After asking that, is there any other concern? If she says 5 complaints, may I know which bothers you the most? Is it the bulge or is it the urinary complaints? So she would say like 5, 6 HOPI, and you want to start management and you're not understanding like which one to address first. You can ask this question. Now, menstrual history. Can you tell me about your periods? When did you get your last one? And offer pregnancy test accordingly if she has skipped her cycle or it is more than 3 weeks. Now, obstetric history. Many of them, students, they ask like, do you have kids? She'll say no. But how do you know whether she had an ectopic or a miscarriage? So you can't judge. What you're supposed to ask is, have you been pregnant before? Then she will tell all the pregnancies that she had. Okay? Be very choosy and specific in the sentences that you're using. Don't ask like, do you have kids? She'll say, I don't have. I want one. But the reason is she had 2 ectopics or she had 3 miscarriages. And she would say, no. So just tell her, have you been pregnant before? Can you tell me more about your pregnancies? It's a very broad and open-ended question. Whatever the role player is instructed to tell the candidate, she'll open her mouth and tell. Some station may require contraception. So are you using any contraception? Don't ask this in a fertility station where they're trying for conception, okay? So are you using any contraception and then you're planning for pregnancy? It doesn't suit. So this question should be asked wherever applicable. STI screening, again, wherever applicable. For example, it is a ruptured ectopic, and she has come. Their STI could be a possibility for damaged tube. So it makes sense there. But for a pulmonary embolism, you're not asking STI screening. Then many of them signpost and make long sentences. I'm so sorry, I'm asking very intrusive questions. Is it okay? Don't be that much formal. Just ask, my duty is to assess sexual health. Have you been treated for any sexual infection in the past? So keep it simple. Screen, I think, just went out. Just a minute. So keep it very simple whenever you're discussing with your the role player about your information gathering. Yeah, I'll just establish this. I hope this is clear till now.
Hmm.
Okay. Yeah. So a part of my duty is to assess sexual health. You can say this, or even more simpler sentence. Few personal questions, may I? This is very simple. So then you ask, and have you been treated for sexual infection in the past? Then cervical screen question, have you undergone cervical screening? Were they normal? Medical history, do you visit GP for any regularly for any conditions and any allergies to medication, metal or substance? Have you undergone surgery on your tummy or down below? Were you admitted or treated? For example, this comes for a chronic conditions like renal transplant, bronchial asthma, where long-standing illness could be there. So were you excuse me, admitted or treated in the hospital for any major problem? Social habits, please keep it very simple. UK, the residents, they are very much clear about social habits. You just have to say few personal questions or few questions, excuse me, on your social life choices. Do not say, I'm so sorry, few of my questions may be intrusive. Is it okay if I ask them? Is this okay if I do this? Don't be so formal in your exam. Your examiner will get irritated with unnecessary questions and prolonging so many, you're building up so much of a background thing and then asking a question. Keep it very straight and simple. They want your information gathering to be over in 2 minutes to 3 minutes maximum. So keep it very simple. Few personal questions. Do you smoke? Take alcohol? Any recreational drugs? Again, recreational drugs, you don't have to ask sorry or be sorry like this. You can ask that. Family history. Any family history of concern you would like to share? What family history they would expect is any history of clots in legs or lungs, sugars, high pressures, cancers in the family, and in conditions like Downs or stations like that, any genetic conditions in the family. So I'll teach you what history exactly you need to ask. Social history, this is very important because to rule out domestic violence, especially in pregnant, what do you do for living? Whom do you live with? How is the support at home? Or is your partner supportive? Or you can ask, are you safe and happy with your partner? These three questions mean the same. Whichever is your convenience, please use them in every station. What do you do for living? Whom do you live with? Are you safe and happy with him? Or what do you do for living? Whom do you live with? Is your partner supportive? These kind. Okay. Mental health. Have you felt down, depressed, or anxious in past few weeks? I would say few weeks. Many of them say 4 weeks. Maybe she's fifth week, she was depressed. You don't know. After 4 weeks, she's all fine. So why do you want to number those weeks and say? Just say, have you felt down, depressed, or anxious in few weeks? And blood group, are you aware? This is important. Any reservation if need arises. Okay, for blood transfusion if need arises. Don't ask this in cases like, maybe Down syndrome where she has just come to discuss the report. She'll ask, do you require blood transfusion, doctor? So she will not. But ectopic pregnancy, you're asking reservation for blood transfusion. Very important. Okay, to rule out Jehovah's. Intraoperative bleeding, and she's a Jehovah's Witness. She would say, I'll not accept blood. I don't want another surgery. You do whatever you want. I don't want to undergo exploration. I don't want blood. So what will you do? So such things and all will be teaching. BMI. This is a very sensitive question where a role player get like angry towards this question. Are you aware about weight to height ratio? Most of the students they say height weight ratio. It is not height and the weight. The weight is the on the nominator and the height is your denominator, right? So please practice it in correct way. Are you aware about weight to height ratio? Is it of a concern to you? She would say, no, doctor, I'm not bothered. Then don't discuss anything about her weight at this moment. You need to discuss in the management plan later on. Because once you say, okay, I'll put you in touch with all the slim clubs, support groups, physiotherapists, like who asked you to put me in touch? I don't want to lose my weight. I have this in my genes. All my family members are like this, and I'm comfortable in this weight. Why should I go to there? Like this gymnastics or something? I don't want to work out. They'll get angry, like why everyone is bothered about my weight. I've seen my friends delivering, and all of them are on the higher side. So it's not something abnormal. They can get very angry on this question. So I'll sensitively tell you all that how to deal with the BMI also. Just have to do not just ask her, is it of concern to you? She would say, yes, doctor, I have been trying but not able to lose weight. Then you explain that what things have to be done for her. If not, do not explain anything now. Management, when it comes, you give example of other women. Say that it was seen, Kelly, that women who had weight to height ratio on the higher side, when they lost some pounds of this, it improved their general well-being. It improved the pregnancy care plan and the baby outcome. So would you like to consider? She would say, okay, let me see. So be it very, keep it very in a gentle manner whenever you're discussing such things. Summarizing may not be required. I never summarized in any of my exam stations that I've passed. So it is not a compulsory that you have to summarize your case, but keep it very short if you're doing. Thank you for sharing information to see that you have been looking for this, and I'll be discussing the management plan. Now you need to tell like, okay, anything else you want to add, which is important. So she is, if any information is missed, she will add on to this. Then towards the end, you can say, or end of your information gathering, you can say, okay, your safety is my utmost priority. Based on information that I've gathered, I'll be offering and discussing the evidence-based management options available for you together. Okay, both of us should agree. So together we can arrive at a mutually agreed safe management plan which is acceptable to you. Towards your end of your station, just say, I've given you a lot of information today. This is an information leaflet about what we discussed, and I'll offer you support groups for your help. I'll fix another appointment with consultant. So if she was supposed to meet consultant, you can fix another one. These are emergency contact numbers for your help. If any queries are there, I'm happy to clear them. So we are there to help and support you in this situation. Are there any doubts, Kelly? You can just ask. So in this way, you have to concentrate on your information gathering, and trust me, it is possible to cover everything in 2 to 3 minutes. So you have to practice it in that way. When it comes to communication with your patient, what important key points you need to concentrate? It's a very important domain. Introduce yourself. Never forget who you are and you are introducing. Know where you are. You don't say, okay, I'm in antenatal. Suddenly you realize, oh, I'm in the gynae UPD. It shouldn't happen. Know why your role player is there. What are her concerns? Explain why you are there. She has come to meet a consultant and you have come. Maybe the consultant is busy. The voice tone is one thing which I want all of you to practice. In our routine day to day life, whatever is the voice tone, for a MRCOG purpose, I want it to be soft. Soft doesn't mean that you are speaking slowly. Soft means the tone of your voice is a bit less. So when you're showing sympathy, it should touch your role player also. Like she should feel that, okay, he is really concerned or she is really concerned. But this comes only with practice. They have taken days and months to correct the voice tone. So I've been telling, no, no, lower your voice again. It doesn't mean that you have to slow down. For example, you say that I have your scan results and it is showing that baby's bowel is bit echogenic and it is showing that some bright structure and it is called echogenic bowel. So I'll be telling you all the tests and all which has to be done. This is one voice tone you're telling about an echogenic bowel. You're doing the difficult news for her. But if you're a good candidate, then you be in a soft manner. Say that, Kelly, I can see that you're alone today. So do you want somebody to be there with you when I discuss the results? She would say, it's okay, doctor. And say that, Kelly, there are some concerns in the report. What I see is I've confirmed your details and it belongs to you. And the baby's bowel, the scan doctor has seen that it is bit echogenic. That means it is appearing as bright as bone. Am I clear with this? Now I have lowered my voice, but speed is not compromised. There's a difference between two communications that I gave. So try to connect with your role play. This is very important. In all my candidates, they understand, like, madam, the recording day one, what I submitted. When I see my day, like, seventh, eighth day of my recording submission, there's a huge difference. And then by the month end, they are like polished. So every time the fluency builds in and you play, trying to connect with your role player there. Signposting means you're giving a warning shot. It's like a breaking bad news. Or sometimes there are stations like negotiation ones. There are stations where you need to explain a condition and agreeing on the mutually agreed safe management plan, decision making, dealing with angry, sad, upset role players. Everything will come in your exam. Listen to them carefully. Debriefing means you have to tell everything that has happened with her event. So they tell that hysterectomy is done. They say about bladder injury, but they don't tell about massive blood transfusion that she has undergone. She may not be aware. So, including that, you have to debrief. Now, duty of candor. So, whenever there is a complication or there is some problem from your side, please do apologize. So that I'm sorry for this, or perform your duty of candor. Be open and honest. Avoid medical jargons and especially abbreviations. Like you have a condition called PCO. Have you heard about? No. You have a condition called polycystic ovary. Have you heard about this? Give information in small chunks. There are candidates who start speaking like, 3 minutes in continuity and then they take a breath. I'm like, no, you give 5, 6 sentences. Just ask, am I clear with this? Or am I clear so far? Then give another chunk of information. Again, check understanding. If you're nodding the head when you're sitting in front of your role player, don't nod too much. Just a small shake, like that is enough. Just nod your head in a mild way. And mind your body language, how you're sitting, how you're trying to connect, eye contact, everything matters. Let the role player make the decision in the end. Be good support to your role player and have a very good supportive ending also. Give information leaflets, put the support groups. When it comes to communication with colleague, this is also very important. This MDT, I tell all my candidates, your management by fourth or fifth minute should begin by mentioning your care will be under team of specialists, which will involve 1, 2, 3, 4, 5, 6. For example, my senior consultant, specialist nurse, senior anesthetist or the pain doctor, scan doctor, blood doctor. So you're mentioning your MDT like this. So every management should begin with an MDT. This is very important. You will never forget in your station. And remember that you're an ST5, not everything. We may be doing a bladder injury repair in our clinical practice. But when it comes to MRCOG exam, we are ST5. We had candidates who are, they are in 20s, they are in their 30s, 40s. The other candidate was like 57. But still, you are ST5 in your exam. It is very important. And you have to leave that, I can manage bladder injury, I know, but for exam purpose, I have to involve my consultant, I have to involve the urologist. So these are important. Remember your ST5. You are not expected to do the complete management of a spina bifida patient who is pregnant, but you should know basic things and put her to MDT. Let them manage. And whenever structured discussion, you need to use an SPAR tool. It means like situation, background, assessment, recommendation. So the situation, like what you're seeing at present, that she has come with heavy menstrual bleeding and other things. In the background history, that she has fibroid uterus. On assessment, she has some, hypotension, tachycardia, she's pale or something like this on doing assessment. I would recommend all this management. So it goes in the SPAR format, and referrals wherever required. Please send, oncology referrals, urogynecology referrals, then specialist care. Like it could be like a genetic counselor. So refer them. Teaching station, when it is there, practice drawing and skill demonstration. Very important when it comes for face-to-face exam. And last November, we had conducted in Bangalore about the circuit course plus the skill drill transfers. So it was very, useful. Everybody performed their task with full confidence. So practice drawing and showing it to your role player. And skill demonstrations also. You can start practicing in your hospitals, in your workplace, everywhere, whatever. Like, for example, forceps is there. Call a nurse or a midwife, somebody, take 10 minutes and start teaching from like day one of your practice. Start doing this. Take out a CTG trace, call a junior, and start teaching. 10 minutes only, whatever you remember. So you try to practice your stations like this. Use resources around you. Involve a junior, practice with study partner, do the discussions. And sometimes OSATs may be required. So these are usually formative or summative. So that comes in the episiotomy station. I'll be teaching there also. When it comes to all safety points and all, like confirming details, checking details on the report, ruling out allergies, Jehovah's Witness, mental capacity, physically competence whenever a young girl has come to ask for something, safeguarding points, LMP, ruling out pregnancy. For especially the male gynecologist, examination in presence of a chaperone with the consent. Never forget to tell this entire sentence, because a chaperone is a must for every examination, be it a female or a male gynecologist. But it is a blunder if you don't say that chaperone is required for examination, especially if it is a male gynecologist. Verbal and a written consent wherever required. A swab count when there is PPH, and you have to tell about swab count. Gum clinic referral if required. Calling for help, very important. If you don't call for help and you're started doing all management by yourself, it's not acceptable. You would have done a central placenta previa in your practice, but there you should call your consultant. Involve midwives, nurses, especially in labor ward prioritization, gynae ward list. Look into the medication chart, dosages, what they have given, whether patient is on suitable contraception or not, whether enhanced recovery programs has to be done, WHO checklist has been checked or not. And this slide is very important, which I have framed. Maintaining confidentiality. And these D's are very important. Debrief, duty of candor, documentation, DVT risk, tactics, discharge summary, and discussion of the case. These are the 7 Ds which I have formed, and you are supposed to tell them in every station whether this applies to the station or not. You have to check. Does this station requires debriefing? Have I done this? It doesn't require. Does this require duty of candor? No, it doesn't. Does it? All cases will require documentation, right? I am going to document our discussion in the notes. This should come towards the end. DVT risk assessment. You will be assessed for your clot risk, and blood thinners will be started if need arises. If there is an incident report, is it required in this station? No, leave it off. Does this station require something like a discharge summary? No. Any particular discussion of the case with seniors? No. So all of them should flash in front of your eyes, but see which one suits your station, and only those you should utter. This slide should flash in front of your eyes by the 9th minute when you're about to close your station. And risk management team, again, where a lot of people, they come together and they evaluate a case, they prepare a report, and final report has to be submitted to the patient also. And if the patient is still angry about what care she has received, she can put a complaint herself in the patient advisory license service, PALS. So they can raise a complaint there also. You can guide through them. Now, speaking about applied clinical knowledge, all of you have this because you're passed with your part two. You have a strong knowledge. Just brush up the recent GTG nice talks. Bash FSRH sign and FIGO may not be required, but make sure that you have a strong base. Whenever you're telling about history, investigations, any blood or urine or imaging, please justify. I want to do full blood count to check for your hemoglobin strength to rule out infection. Something like this. You have to justify. I want to do the get your scan done to rule out any collection in your tummy. Why are you doing? And what are you doing? Justify. Have a structured approach and put up a skeleton for your management. This I tell for every station and every candidate, that why don't you start your management by putting up a skeleton, in the sense this patient may require lifestyle changes, pelvic floor muscle exercises, surgery, and rare cases medical line. It's a case of SCY. So tell your role player that we have different options. Like there are lifestyle changes, there are supervised exercises for your muscles down there, and there are surgical options which can be the keyhole or an open surgery. And in rare case where they do not want to go for these, there are medicines also which are short term like efficacy. Is there anything that you want me to discuss? She will tell doctor, I don't want surgery. Please tell me something else. My role player will cut down the management point. Don't sit on explaining surgical option because she's having SUI. She doesn't want surgery. Why are you still? No, this is good for you. Please let me tell you. You listen. She will not listen. So you don't have to tell all these stuff. If she says surgery, no, leave it off. Tell other points and tell her that this is also like one of the best options. So do you want to discuss? She'll say, no, doctor, leave it off. Don't waste your time. But it's your duty to tell her that this is a option that is available, and then it gives a very good result, right? If it is a faster recovery, a laparoscopic burst colpo suspension is going to give her faster recovery and effective treatment. But she doesn't want that. She wants only probably only PFMT she wants to try, and if it fails, then she wants to try medicine. I don't want surgery. She may tell like that. So it depends how stepwise approach and how counseling you're doing. So please put up a skeleton of management in your mind. Tell her that 1, 2, 3 are available, but 1 or 2 may not suit you. So what remains is 3 and 4. Explain everything and let the role player make an informed choice. If she wants, I want to know everything, then tell her and let her make a choice, which is going to be evidence based also, and it is acceptable to her. So this is how it goes. Whenever you come to management, remember MDT. And clinical management and clinical governance both should flash in front of your eyes. It could be expectant, conservative, or lifestyle. It could be medical line. It could be surgical line. Again, it could be conservative or it could be definitive. Like this, you have to create a picture in your mind. And towards the end, do not forget to tell the clinical governance points. Okay. Know your domains. Start preparation. Start performing stations in the Telegram groups. HOPI. What about information gathering? Am I doing correct signposting? Excuse me. Am I offering examination? What about investigation? What is the clinical management? Check understanding in between. Tell about MDT. You're an ST5. Do not manage everything alone. And clinical governance are important points. Give towards the end information leaflet support group. If GP has written a letter and sent right back to GP with her permission, MDT and a consultant involvement. This could be required. Now 24/7 hospital numbers you can provide wherever there is a risk and follow up with the next appointment. If it is Osler, there are 14 stations. Give your best performance. It's going to be online. A lot of things will come into place, like your internet, your role players internet, examiners internet, the chaperones internet, everything will come into role. But it is possible to have a good exam also online. And now when you're preparing, you should have a smart approach to station. For example, excuse me, um, when I was taking circuits and all, they used to take information and suddenly they remembered, okay, blood group I didn't ask. Then the candidates are like, I'm so sorry, I forgot. May I know what is your blood group? Then towards the feedback, I was telling her like, why you have to tell that you forgot and you have to be sorry in front of your role player? Just say that, okay, having said this, may I know your blood group? Just be casual. Just take it naturally. Why you will feel sorry that you forgot? Why you will tell her also that you forgot and now you're asking? You should be very smart in your stations. And everything like will be teaching you how to go ahead with that, how to pass the station by smart approach. Hard work is important, but smart work is also important. There should be dedication from both our sides, from your side, from our sides. The help will be available. Like as the station goes, help and support. So we are also there as a mentors to give you a good support. So you have to be confident. You have to be smart from day one. Apply the knowledge from your part two exam over here, but clinically. Have a study partner who is strict. Today we have to finish three tasks means three tasks. And family member you can involve as your role player. Friends, if they are free, non-medicals also is okay. Now, in OPD of your outpatient department in your hospital, start taking history and everything, examination management, everything, fadafat within 10 minutes, it should be over. Start doing this in your clinical practice. You can give yourself extra 2 minutes for the examination or something because that we don't do in your part 3 exam. But make sure your OPD runs quickly and you're doing everything in 10 minutes. They are your best role players. Take hold of nurses, explain them all the teaching stations within 10 minutes. If nobody is there, stand in front of the mirror and practice. And we also take one-to-one stations and all as mentors if they want some extra help like that. Never get exhausted. At every station, you should be fresh. There is no chance that you are going to get exhausted in mid-circuit. Every station, maybe it is the last two, three stations which is going to clear you with good marks also. You never know. Never get exhausted at any point in your exam. So for that purpose, practicing mocks will be important towards the end. You can take a mock of 5 stations, 7, 10, or perform full 14 circuits also. Like the last candidate, even till yesterday, I was taking for her. She has exam tomorrow. So till yesterday, it was a last circuit. So she performed like 5 complete 14 station circuits with me. And every circuit I had given like different stations. So it was like her revision of 70 stations. So it just, how you want to do it. There were candidates who had taken 8 complete circuits. There are candidates who do every module 5 stations. So it all depends like how you want to revise towards the end. Take off from work if required only towards the exam, but if you're comfortable working, leave it off. If family commitments are there, if any help is required, please do arrange, especially within the last 2 weeks. Practice reading fast. And I ask my candidates to practice the books and all in the Telegram groups, reading the station in 2 minutes and noting down the important points. This is very important. From day one, practice speaking faster. And if you're planning for online, typing faster is important. So type only the bullet points which you need to speak. Try to complete the task in 9 minutes. Keep that as your target. No 10 minutes. It is 9 minutes. It should be perfect. It should be fluent. You should be confident from the beginning. So have a very good confident start. The way you start your station, examiner decides that you're going to pass. Your role player knows that she's the best doctor. I want to go to her only. So that should be the confidence that they gain in you. So have a very good confident beginning and very impressive ending. Okay, so this every task has a different approach. So how you need to begin, how you need to end. So we'll be teaching this also in the live sessions. So let us start the journey. Quickly, I'll introduce mentors. So this is me, Dr. Rashmi Patil. I'm from Bangalore, India, and I'm working as consultant at Motherhood Hospital in Bangalore. And I passed in November 2019. Day one was my exam. So that time it was like a face to face in Chennai. It was a good exam and conducted really well. and later just graduated in Feb 2020 with the convocation held, and after that there was COVID and shutdown, and a lot of candidates they couldn't give exam, or even the convocations were withheld. So let me tell you, this is a very important moment in my life. They just make you feel blessed when you go there for convocation. So if you're getting a time and if circumstances allow, please do attend your convocation in UK. Is the best part. They really stand in lines and clap for you and cheer you, when you get graduated. That feeling is different. uh, Here we have our next mentor, Dr. Geetika Arora. She's from Delhi, and she has been with us, Rayz Academy, since couple of years, and she'll be taking few of this like the sessions as well. Dr. Siddesh, he is from Mumbai, and he is urogynecologist, so he'll be taking the urogyne module for you people. He has been examiner in the past 3 exams, and really knows that how to cut short the candidates all those sentences, or this is like kya baat kar rahe ho? You have to cut short on this. She's Dr. Rupali Bansal. She is from NHS. She works over there, and she'll be dealing with the clinical governance session. So we are the mentors here. A comprehensive live session, which our course is currently like almost booked now. So this consists of 15 live sessions, which will cover the 19 stations in a detailed explanation manner. We take only 6 candidates in batch, so that every candidate gets to present in every session. If somebody is absent, the task goes to the next person. It keeps circulating, everyone will may get an extra chance also. But we make sure that all the 6 stations are completed, and all candidates are getting equal opportunity, and every session they are presenting. Okay, because it's very essential that you speak to mentors. We want to listen to you, and it's not only listening on Telegram, because Telegram we use the practice books where unlimited task feedbacks we start. I'll be assigning all the tasks on daily basis, and I want you also to submit your task on daily basis. There were candidates who had finished like 5 books before the gave exam, like entire 5 books were covered. So it is very important as a team. When you form a batch, as a team you're working. As and when you submit the task, I'll be providing next, and it's me and Dr. Geetika only that we give the feedbacks, nobody else. And about 5 sessions later on, which we may plan about having mixed bag, where another 12 stations in every session will be covered, so almost like 60 session, but this is going to be like towards the exam. So candidate can practice, and only like in a rapid way, like 5 minutes, what is the main gist of the station that you need to tell. Okay, so this is one another step. Then there is something called marathon course, which I run before the exam. It is a kind of revision that I do for you. Candidates don't participate actively, they are all listeners. When you're tired of submitting tasks, reading, revising, you don't know what to do, just sit back and relax and listen to me. So where I'll be solving all the recent most 100 recalls like that in almost like 5 or max 6 days, where every day like 15 to 20 stations are covered like that. And it is a quick revision that I do. Only key points, what you need to focus in your exam. It is a revision, so this is a marathon course, and if our candidates are interested, they can join in, and the course students will be getting a discount also. The next step will be circuit, where you practice like 14 station as an individual candidate. So I also take circuits, Dr. Geetika also takes circuits. So it is the one-to-one where you are performing with me, and all the 14 tasks in a go, or you can take a break after 7 station for 5 minutes something. It's going to be like a real exam like approach, where timers are put up. Then you go on submitting your task, and the next one timer again. A detailed feedback and a fine tuning will be done. What exactly you need to concentrate. So these are going to be the 4 steps that will help you how to comprehensively have an approach. It is best for the beginners, and if you're going for the next attempt also, we do a lot of work in the Telegram. And there is one more group called as a recall group, warriors group. It's very famous among our course students, because everyone practices recalls in that group, and they keep submitting. You might have seen now so many tasks and all, they keep practicing, and especially the exam going batch, they become active. And the previous batches, they just listen to the senior batches how they are performing, and so many people have given exams just by listening to those recalls, and they have passed their exam. because constantly you're listening, you're going through feedbacks. It's not only your effort, but somebody else's effort also you are being benefited, and we all like work as a group. All the course group people come together in the Warriors Recall group and we practice. Those are specially for recalls. The books, everything, the Telegram groups, there are separate course groups which are created. So you will be practicing books in that group. You will be practicing exclusively the recalls in the Warriors group. Plus, there is a library which I've created where more than like 500 solved recall, like stations and all, voice task which my students have submitted. Everything, the good one, they have been selected and they have been put up. This is just for read, like listening purpose. Whenever you're free, just log into the library, listen to a recording, go to the next. And before you give your module, we are starting with live session from next week. So before you start your module, I want all of you to go through, for example, early pregnancy. Next week, if I'm keeping a session, you have to listen all the early pregnancy records. You have to go through, read the PDFs that are there in the early pregnancy. Be prepared and have a strong hold on early pregnancy and confidently come and discuss in the live session. All these are going to help you. And the more you practice, the more you submit your task, we are able to listen to you. I will find two new people. Okay, whether it is, even the questions, whether the fluency, whatever it is, this has to be fine tuned. So I'll help you all with that. And the unlimited task, as I said, and study materials, all the library access will be given. Most of the students, I don't know, but they say like, they have paid for the course, then they ask like, I'm not getting much thing to practice or something. So I would say, just when you're choosing a particular course, be like, do your homework, find out who is offering what. So it is very important, because part 1 and 2 are different, part 3 is completely different. It is you who has to speak and I have to listen more, and then only I'll be able to judge you, right? And then only I'll be able to correct you, fine tune with the voice, then tell about management options, how exactly you're supposed to say, give a good feedback. So this is very important. A lot of courses may be offering the same thing for you people, but be very much clear that which course is offering you what are your benefits in that, how many cases you are. There are courses where they are hardly presenting 3 or 5 cases, but how can I just listen to 3 cases of yours and prepare you for the exam? No, I have to listen like hundreds of your voice recordings, which I do in the Telegram. As a team we do, and then we make you practice in every session. Okay, and it's not like only one task you're preparing, it's all the 6 stations that you need to prepare. So everything that you want, a complete course, we are there to provide you. So you can join and start choosing like your courses, and wisely choose the mentor and the course, I would say. Have a happy studying, and all wholehearted welcome from the entire team of Rayz Academy. If you people have any doubts, let me know. And my course Telegram groups who have joined now, so I'll be putting up the schedule for the next week onwards, like what all things have to be done, and I'll be putting up the stations that you need to practice, and those 6 stations will be covered in the upcoming live session. So every session before that, I'll be putting up what next stations you need to prepare. Okay. So all the best, all of you. If you have any doubts, please put on in the Telegram groups. You can, get in touch with me. All my students say, that I'm very much approachable. I am thankful for that. So any doubts, anything that you have, I'm really there, happy to clear everything for you. And whenever I'm getting time, I'll be getting and clearing all your doubts also. In the groups, we are going to start practice, so I'll be putting up all the task and all I will be assigning. So candidates who are waiting to book the course, and they're waiting for the part 2 results, so if you wish to be included in the batch, get in touch with me, and I hope you get a positive result only. That is what like we pray. But by chance, if there is a negative result also, you will be assigned to the next batch. Okay, so your payment, everything, it will be carried over to the next course, and I hope that all of you pass your part 2 and come to the course, the part 3. But we need to start it earlier because we need to complete our sessions. Otherwise, May is approaching, and we have like these 3 months to concentrate fully on the preparation. So just get in touch with me. We'll also let you know. So whatever doubts that you have, you can directly message me on the Telegram also. Okay. So all the best. See you all in the Telegram groups. Have a nice time. Any doubts are there, please put up in the group also. I'll get back to you. Is it clear, everyone? Thank you for joining in.
Thank you, ma'am.
Thank you. Take care.
Thank you, ma'am.
Thank you.